Well, welcome to today's news and updates. And I've got a couple of interesting papers to look at later today, time permitting. So we're on Tuesday, the 11th of February 2020, novel coronavirus. And so far we've been calling this the Wuhan novel coronavirus of 2019, NCOV, novel coronavirus. But you'll be relieved to hear that in its wisdom, the World Health Organization has now given it an official name. So I think we're going to have to go by this in future, as the World Health Organization has declared it to be the case. So coronavirus disease, coronavirus disease, abbreviated to COVID. So the virus is now called COVID-19. It's going to take me a while to get used to that, I think. So this outbreak, and what I fear is going to be a pandemic, alas, I fear it's going to be a pandemic, is now called the COVID-19, as for 2019. So it's CO for corona, VI for virus, I'm guessing here, of course, D for disease, 19 for 2019. So COVID-19. So let's see if we can do that today. Now, confirmed cases. Confirmed cases today from the Chinese authorities, 43,143. Now, people have often asked me numerous times on the emails and comments and feedback, do I accept the Chinese figures? Do I think the actual figures are higher? I've often been asked that question. All I can say is that the modelling that we looked at in previous videos would suggest that yes, these numbers are low compared to the actual figures. Now, I'm not criticising the Chinese authorities. In many ways, they've done a spectacular job of trying to contain this virus, COVID-19. But there's always a lag time. So confirmed cases, 43,143. Suspected cases, 21,675. Now, these are cases which are suspected by the Chinese authorities. Now, I think what's been happening here is that the Chinese authorities have actually tested these people. So these have been sort of pathologically diagnosed by looking for the presence of the virus, the antigen test, which is good. But I'm sure the Chinese nurses and doctors now are well able to recognise this syndrome. So I see no reason not to assume with this justification that the true number of cases are this and this added together. Now, the Chinese website that I showed you yesterday publishes the number of cases that are severe. And this is a particular concern of mine, and I've done some sums that we're going to look at in a minute. I think I got the sums slightly wrong yesterday, just to keep you on your toes, so apologies for that. Don't trust me, get your calculator out, work them out for yourself. This is on the hoof, practical epidemiology. Confirmed deaths, 1,018 confirmed deaths. Recovered, 4,347. Affected countries, 28. And in the news today, I've included basic reproduction number, the R0. Now, if you've been following this series, you remember that the R0 is the average number of cases that each person will spread it onto. So if the disease grows by a particular amount, we can look back and say, well, each person passed it on to 2 people, or each person passed it on to 3 people. And we're currently estimating this at 2.6. Now, other peer-reviewed published material has published this at 2.2 today. But I'm taking this from Imperial College London, which is a recognised World Health Organization collaborator. So I think that's a fairly good authority. This is what the WHO and the Imperial College are saying at the moment. And they have some pretty clever people working there. So I'm happy to go with that, 2.6. Although we saw yesterday this English guy who's actually been named now. I can't remember his name, but he infected 7 or 8 people that we know of, and potentially, unfortunately, many more. He personally did the right thing. He did call in by telephone. He did self-isolate and went and followed the instructions from the medical teams. So he actually did the right thing, but that doesn't alter the fact that he's a super spreader and has spread it to many people. So this 2.6 R0 is an average. Of course, for an epidemic to subside, that's got to be less than 1. So for an epidemic to subside, every infected person has to give it to less than one other person. So we're well over that, unfortunately. And as I mentioned yesterday, I can't quite get over this, but the Chinese government officials have been saying that this is now spread by aerosolization, spread in the air. And I really don't want to be alarmist, but there are people in Japan in isolation, in quarantine on this cruise ship, and some are in inside cabins, and they're going to depend on circulated air. So I'm sure the ship captain is well aware of this problem. So that's why I think this is going to be a pandemic, because of its spread in the air. And I mean, the measures the Chinese government have taken have been staggering. They've done amazing things, quite amazing things, and yet still the disease is spreading. So we'll keep an eye on those figures as we go on, as we have been doing. 2.0. Now, the Chinese government, you'll be pleased to hear, has banned the sale of wildlife in markets, restaurants and online, because this is a zoonotic infection. It is spillover from the animal kingdom. So that has now been banned in China. And I think it was before, but it wasn't really enforced as far as I know. But this time I strongly suspect it is going to be enforced. Now, I know this is a Chinese cultural practice, eating these wild animals. So they're just going to have to start eating something else, I would imagine. I've been to China in the last few years, and there's no starvation or anything there. There are other food sources available. So eating wild animals is now illegal, and their sale is illegal in China. So hopefully this will prevent further zoonotic spread, although of course it's far too late for the current outbreak, which is now happily or unhappily spreading from person to person. Now, I came across an utterly bizarre story today. I mean, I shouldn't laugh, it's really serious. The Westerdam cruise ship is bobbing around in that area. And as far as I know, it set sail from Hong Kong on I think it was supposed to be a 19-day luxury cruise, and these poor people on board are basically stuck there. Thailand, Bangkok, has refused to let them dock. Now, the Thai authorities generously said they would give them fuel, food, supplies, whatever they need, but they couldn't dock in Thailand. And previously, the same ship had been refused permission to dock in Japan, so the passengers can't embark, that they're imprisoned on this ship on the high seas. Taiwan had refused to let them in. The Philippines had refused to let them dock, and the US territory of Guam had refused to let them dock. So no one wants them. Quite a bizarre story. Quite what's going to happen to them isn't clear at the moment. Some sources say they have sick people on board. The crew themselves on the Westerdam say there is no sick people on board. But it's quite a bizarre story. So this is a sort of a refugee ship almost that no one wants. And there are 600 Americans on board, and they have contacted senior American authorities. So hopefully they'll do something soon. But quite a bizarre story. But you can understand it. If the ship docked in any of these ports, I mean, Japan are already dealing with one outbreak. They've had to transfer, I think it was 136 people off the ship who've tested positive in Yokohama. So just think of the cost of that to the Japanese authorities. It's not insignificant. 136 people who require isolated care, not just care, completely isolated care. So you can understand that these governments were rather reluctant to take on that responsibility of potentially having several thousand people with the disease on their hands. You can understand it, but it doesn't help the plight of the people that are on the ship. So quite a bizarre story. So keep an eye on that one. What will happen? We don't know yet. I would assume if they have no cases in 14 days, they'll be allowed to dock. But suppose they do have cases. It's not clear. British Airways cancelled all flights to Beijing and Shanghai. I'm not sure they fly to anywhere else in China at the moment till April the 1st. I think they're still flying to Hong Kong. And as far as I've heard, I do apologise for being so satirical about the World Health Organization at the start of this video. It's quite inappropriate, really. But as far as I know, the World Health Organization have still said that flying in and out of China is not a risk or acceptable. I don't quite understand. Clearly it's a risk. I don't really understand their thinking at all in this matter, I'm afraid. Anyway, what I wanted to mention now, just supposed to be brief, but what I'm concerned about here is we have the overall number of cases, which are probably these two, and these are the number of severe cases, presumably that are severe enough to require hospitalisation. Now, because there's so many cases in Wuhan, they built a new hospital. Was it in 10 days or something? They had a live feed, and this hospital was built in like 10 days or 2 weeks or something. Absolutely amazing, and it's full of patients now. But that shows you that the medical facilities in Wuhan were overwhelmed. They had to delegate halls and put beds up in halls. They had to build a new hospital. And probably only the Chinese could build a hospital in under 2 weeks and have it operational. I mean, I don't know about where you are, but where I am, it would take 2 weeks to argue about a meeting for the first meeting, to organise the first meeting. We couldn't have a response, anything like that. So here's my sums. There's 7,333 severe cases. That's the severe cases. And these were the number of suspected cases, and this is the total number of confirmed cases. So add up the suspected and the confirmed. So they're the suspected, they're confirmed, and we get 64,816, I think. So they're the severe cases. Now, what I wanted to know was what proportion of cases are going to be severe, because this is what I want to know. I want to know, if I get it, what my chances of being seriously ill are. You do. I want to know what my children, what risks they're running. You do. You want to know if your wife is going to be severely ill, or your husband's going to be severely ill, or parents, of course. So what I've done here is 7,333 severe cases, and we're assuming that this is the total number of cases, 64,000 here. That's adding up the Chinese suspected cases and the Chinese diagnosed cases. And that gives us a percentage of 11% of severe cases. People that are really quite ill and probably require some sort of support, such as oxygen therapy. Or even more support than that, but oxygen therapy would kind of be the minimum these patients would want, I would think. If we take a kind of a worst case scenario and we just take the confirmed cases versus the severe cases, that would give us 17% of people having a severe disease when they catch this new virus. I've forgotten the name already. The new coronavirus is here. The COVID 2019 virus. My personal view is that the Chinese nurses and doctors can diagnose, so I would suspect this is nearer the proper condition, so I'm suspecting this is nearer. Although, to be fair, this is nearer some of the other published data as well. But that means if we get 10,000 people with the disease in a hometown, 10,000 people with the disease, then that means 1,100 are going to have severe disease. Most places don't have the facilities for this. I've worked on A&E departments recently, and sometimes you can't cope on a Monday morning. You know, the idea of another 1,000 patients is just unthinkable. We just don't have the facilities for this. Let's hope either this is wrong, or I'm wrong, or the disease isn't going to spread, or the number of severe cases is less. But if not, I don't really see how the existing health service can care for all the patients that are probably going to need help. Let's hope there's an error in my logic somewhere. Okay, I'm going to leave that one for now. As I've said, there have been problems with these videos posting things, and I won't go into details. And I know the names are a bit silly, but there's a good reason for that. It's not what I would normally do. Normally I'm meticulous about my filing and labelling, but there's a reason we need to do that at the moment. So I'm going to post that one, and I think we'll see how we get on. But I've got 2 other papers to show you that are very interesting, so we'll get back soon with those.